All right, to begin, this week we will be discussing an article written by Peter et al. And the name of the article is The Role of Magnesium in Depression, Migraine, Alzheimer's Disease, and Cognitive Health, a comprehensive review. So, this is a meta review. This is in the Journal of Nutrients, and this was published on July 2025. So, let's look at the abstract. The article, the main idea of this article is that magnesium may play some sort of role in attenuating Alzheimer's disease and dementia. More specifically, the authors are going to they're going to dive deeper into the psychiatric disorders known as depression and migraine and how magnesium kind of helps with those. But at the end, we will discuss how it helps with Alzheimer's disease and kind of how it attenuates it and if this could be a possible cure for this. So they want to understand the relationship between magnesium and this disorder through a narrative review of relevant clinical studies. The findings may provide insights and the potential therapeutic applications of magnesium and guide the future directions of the research into the prevention and treatment of depression, migraine, and Alzheimer's disease, and overall cognitive health. So mostly in this study, there was a lot of discrepancies about how magnesium is helping in the patients. Fact is, there wasn't a specific type of magnesium that was helping. They would use magnesium chloride in some of the studies, or magnesium sulfate, or magnesium oxide. And in when they did use them, they never used them in the same amount of dosages to kind of show whether this dosage is what is conferring this effect. And the other fact that wasn't taken into account was how much serum levels were in the patients before they gave them the magnesium, and that would kind of let the reader know whether it's the amount of magnesium that was added into their blood that kind of caused the effect, or whether it was something else that caused it. But here in this specific paragraph here, they were talking about how depression is attenuated by magnesium levels. So in the case of depression, multiple observational studies have demonstrated a correlation between low serum magnesium levels and depressive symptoms. So magnesium is known to regulate key transmitters such as serotonin, GABA, and HPA axis, as well as the NMDA receptor. So the HPA axis is the hypothalamic pituitary adrenal axis. It's a stress response axis, or it's an axis that's activated by the stress response, and is usually kind of more affected with when it is affected. It tends to lead to kind of metabolic syndromes, and you have usually anxiety disorders as well as depression. Usually, when you're dealing with something with some aberrant HPA axis, usually you're dealing with some anxiety disorder or depressive disorder. So here, mechanisms that are dysregulated in depression, interventional studies using magnesium sublimation, so particularly magnesium glycinate or magnesium L-threonate, have shown symptom improvements in mild to moderate depression, though the results remain mixed due to variations in the sample sizes, dosages, and treatment durations. So in migraines, the oral magnesium supplementation, often in the form of magnesium citrate or magnesium oxide, has demonstrated efficacy in reducing the frequency and severity of attacks, particularly among patients experiencing migraine with aura. So magnesium appears to inhibit corticospreading depression and stabilize vascular tone, which are both implicated in migraine pathophysiology. So it seems that when you put in magnesium into somebody, it can help with the depression and the and ensuring that the vascular tone is in good condition. So studies on intravenous magnesium sulfate supplementation for acute migraine attacks have yielded conflicting results. Some randomized trials reported rapid pain relief following infusion. Others found no significant benefit compared to the under a placebo or the conventional treatment. So again, it's not too concrete or too clear whether magnesium is doing something here. Well, no, sorry, let me say that again. It's not concrete as to how much magnesium we need in order to know if it's doing something. It depends on whether it's a specific dose, or whether the person already had something in their body that's working with the magnesium to help them. So when it comes to dementia, epidemiological studies have identified a U-shaped relation between serum magnesium levels and dementia risk. So both hypomagnesemia and hypermagnesemia appear to increase the likelihood of cognitive decline. So the optimal serum range associated with lower dementia risk is estimated of 0.80 to 0.88 millimoles per liter. So you don't want to have too much magnesium and you don't want to have too low magnesium. You want to have a balanced amount of magnesium in your diet, which is kind of like the most like like the best kind of advice when it comes to these type of things. Being balanced is the key. So you have to ensure that you have the proper balance of magnesium in order to maintain yourselves, maintain your inside, maintain your body. The preclinical studies further show that magnesium supplementation can improve synaptic plasticity, dendritic spine morphology, and reduce tau hyperphosphorylation. We know how tau hyperphosphorylation and dendritic spine morphology and synaptic plasticity are all ruined when Alzheimer's disease takes hold. So it's kind of important to take that into account. So, we don't know whether magnesium does cause any type of symptom alleviation or pathogenic disruption. We do know that it's good for preventing. So that's what we want to focus on in this specific article here. It's preventing. While magnesium has shown potential neuroprotective effects, several studies have reported no significant cognitive benefit, particularly in the advanced stages of Alzheimer's disease. That's the only problem. Another thing that we should take into account is that magnesium supplementation has been shown to inhibit the activation of the NFKB pathway, which is known to which is a pathway that leads to cytokine production, which are usually pro-inflammatory. So if it reduces this, then it can kind of reduce the burden that comes with Alzheimer's disease. So this is known to contribute to neurodegenerative progression. So intracellular magnesium exerts neuroprotective effects through multiple mechanisms. It modulates calcium homeostasis, reduces oxidative stress, attenuates neuroinflammation, and enhances ATP production in the mitochondria. It's another thing about magnesium that I should take into account, that I want to take into account here, is that on top of it kind of having anti-inflammatory and antioxidant effects, it also helps the mitochondria function well. And if you know Alzheimer's disease, you know that it usually kind of affects everything, including mitochondria. And if mitochondria are not working properly, then they're not going to be able to help the neuron produce its energy. And if you don't have energy inside your neuron, then your neuron is not functioning. So put it in a way where you have somebody who has progressed with their Alzheimer's disease, and nothing is really working in preventing or reducing the amount of symptoms they're presenting with. Introducing magnesium into their diet perhaps could kind of help with the deficits by it going in towards mitochondria and helping it do its work. Thereby, you have the person producing ATP production again, and mitochondrial function kind of taking hold and allowing the neuron to do the work. Although at the time, the amount of damage that may have occurred might be too much to kind of show any meaningful effects, but it's just knowing the fact that magnesium might, even though it wasn't done before the treatment took hold, before the disease took hold. It's good to know that when you do apply the magnesium at that time, it will kind of attenuate, or has a chance of attenuating or reducing some of the symptoms that are associated with the disease. Another thing to note as well is the ratio of calcium to magnesium. Usually, when it comes to dementia, there tends to be a higher rate or higher ratio of calcium to magnesium, and usually what that happens is it's going to lead to more excitability. Excitability might lead to excitotoxicity and further downstream effects that eventually just lead to further damage. But if you have the client or the patient taking more magnesium supplements, they can increase the ratio of magnesium to calcium and reduce the chance of there having any excitotoxic related damage. So we can say here basically that its role as a neuroprotective nutrient is supported by experimental and epidemiological findings, although robust long-term clinical trials are needed to determine its therapeutic potential across specific patient populations. While not yet established as a first-line treatment, magnesium supplementation may hold clinical utility as an adjunctive strategy, particularly in individuals with a suboptimal magnesium status or a heightened neuroinflammatory burden. Basically, that's what they're saying. So to just take note, what this article is saying, that magnesium may not be the full treatment, but it may be something that people who are looking to find reliable or available or treatment strategies for Alzheimer's disease, they can incorporate magnesium into their studies, and maybe magnesium can work with whatever agent they're using to try to attack Alzheimer's disease. Maybe an agent that kind of stops the degeneration all at once, plus magnesium. Magnesium is basically a type of therapy that's known as adjunct, meaning it properly works when it's paired with something else. All right, that's pretty much it for the article today. Thank you so much for watching, and I hope you have a good day. Bye.